My project, or the project that we're working on, is a project on tuberculosis, and it's a scale-up of a small pilot called Proper Care, which has even gone which has then transitioned into what the EC has funded called Impact TV, and then went even beyond that into a stage called Zero TB Viet Nam. Where we started, and just set a little bit of the background, was in 2014, Viet Nam issued kind of this flyer together with the World Health Organization saying that each year that tuberculosis is still a giant problem in Vietnam, and that each year there are 130,000 cases, of which roughly 30,000 are missed, that continue transmission in the community. And with that, there was a second problem, which is that once they're found, many of them aren't retained or held onto treatment, which led to the continued development of drug-resistant TB. That same flyer also called out key areas of intervention, which were to expand access to care to the community, to expand screening and diagnosis for those seeking help, and to enhance linkages to the different stakeholders in TB control. And basically, this was our blueprint, our map of what we wanted to do when we developed our pilot project. And this pilot project is what we called Project Proper Care. And on Proper Care, we were fortunate enough to link with the various stakeholders at the grassroots level, including a local NGO called the Ho Chi Minh City Public Health Association, the District Health Center of Go Vap District, one of the 24 districts in Ho Chi Minh City in which we piloted this project, and the Pham Ngo That TB Hospital, which was in charge of the tuberculosis program of the city. And so together we sat down around the table and we said, well, how do we want to design this program or this pilot? And so we said that there are three main strategies basically around that flyer that I had just presented, which is number one, we want to involve the community. We want to reach out using community members, recruiting from existing networks that includes Women's Association, Red Cross Association, or the Union of the Elderly Population. And we want to use these to go into the community and engage and conduct outreach activities such as contact investigation and high-risk screening. Then we wanted to do what was in the third box on the bottom, which is stakeholder engagement. Reach out to private clinics, polyclinics, private providers, pharmacies, and just get them enrolled and engaged to refer anyone who comes across as suffering from suspected TB. And then using the same team of community health workers engage in patient-centric care, meaning that they'll support sample collection and transport, they answer questions via text message or phone calls, they go to the homes and provide counseling and these type of activities that make treatment less treatment and more something, a way to get better. With two main goals, essentially, which is, again, captured in the problem statement on the first slide, which is find more cases, find more of the missing cases, and then minimize loss to follow-up. And so some of the key points here that will come out later is what I can just call out here. Is the first one is institutionalization, or is to make sure that we engage a lot of the individual actors at the grassroots level. And then what we also try to do is have a little bit of a systematic approach, and here's evidence of the gaps, and here are some of the things that we want to do. And so where we went from there on is, as I said, the first one was to go with Project Proper Care in one district. In fact, we started at 3 sub-districts and scaled up to the entire district of 16 sub-districts in the first year. But then we're funded by Johnson & Johnson, who thought this was a nice idea. Let's see if this works in other settings. And the idea with the Johnson & Johnson project was that we would sustain the activities in Go Vap to push for localized elimination and transition. And the nice thing there was that the district health director then decided to take our project and embed it within his TB control plan, even committed domestic funding from his own budget to sustain the community health worker network. And but then at the same time to take the model and test it in a semi-rural district of Ho Chi Minh City, and another urban district by using a different model, using a model that used, instead of instead of employees, use community health workers. And that idea of employee versus community health worker model came about because we presented our initial results. Other districts became interested and said, oh yeah, this looks great. How much did it cost you? It's always going to be the question, how much does it cost you? And when we told, yeah, we're paying our community health worker $130 a month, they turned around and said, oh, this is not sustainable. I can't employ anybody at that rate. And so based on that question, we submitted to the EU a proposal to say, well, can we then look into the effectiveness and cost effectiveness of a salaried employee model versus a community health worker model. But before we knew it, there was another grant that was granted, and the National TB Control Program got interested, and with that grant and in support of the National TB Control Program, this project was expanded to 2 other cities, with Ho Chi Minh City being the first in the south, another city being in the center, Hoi An, and then another city in the north, in Haiphong, with the strategic objectives of Ho Chi Minh City and Haiphong being high burden cities to see if we can reduce the burden there, and Hoi An in the center being a low burden city to see if we can push for a local elimination. So that what I just described was the first was in terms of horizontal expansion, horizontal scale up, but also with regards to the vertical scale up, not just now involving the district or even the provincial level, but now going all the way up to the national level at the National TB Control Program in the ministry. And I will say a little bit more about the details, about even scaling up across administrative levels in a little bit, but I think I'll stop my presentation here, and then look forward to sharing more on the project with you later. Acknowledgement for the different stakeholders, and thank you.
Thank you very much.